Everyone, I'm Rick Fleet. I'm an emergency physician and clinical health psychologist. Really have, in the context of the Cape Wellness Week, I have the immense honor to interview Marie-Claude Miron. Dr. Miron is a radiologist at Hôpital Sainte-Justine, our large academic, one of the two large academic hospitals in Montreal with l'Université de Montréal. Dr. Miron founded the peer support program at Hôpital Sainte-Justine, and it's a great pleasure to have you here today. How are you today, Dr. Miron, in the context of this fifth wave of the pandemic? How are you feeling?
Hi everyone. Thank you, Dr. Fleet, to receive me. It's a difficult time for everyone, and I think that it's a very, very good thing to, if you never started yet, maybe not a formal program, but at least to start to think about the well-being. So it's a great thing to do, especially in these times, but we have to consider that the pandemic is something, but every day we have to deal with difficult periods, difficult situation with patients, or personally, which can affect our professional life. So it's really important to start thinking about well-being if it's not done yet. And I just want to say that you probably already noticed that my English is not perfect. It's not my mother tongue, and I can tell you that off the record, I asked Dr. Fleet to jump in the conversation if he feels that I'm hesitating a little bit with my English.
I think you're downplaying your English there, Dr. Miron. You're very humble. Your English is absolutely perfect. So, Dr. Miron, we have the reflex. If things are not going well, we know there are professional resources for us, psychologists, our formal physician wellness programs, but you're into peer support, how we can help each other. And you really got this idea based on a tragic event that happened to you a few years ago. Would you mind sharing us how you got the idea of starting a peer support program at Sainte-Justine Hospital?
Yes. I'm comfortable to talk about it. So 5 years ago, my partner, who was a pediatrician at Sainte-Justine, and I was working with him, he suicide. This tragic event happened because of his professional life. We were really happy. He was the father of 4 very wonderful kids. So it was really because of something which happened in his life, in professional life, that he committed suicide. So he was for 3 years in a very, very, very difficult situation. And even if I was there for him, he considered me, obviously, as his partner and not a colleague. And during the time he was in this difficult period for 3 years, I noticed that he didn't receive any help or any support by the people at the hospital, mainly the doctors. It's difficult for a lot of people, it's difficult to ask, how are you? And to be able to receive, I'm not going well. So, people avoid to ask. So it was really, really tough for him. And when he committed suicide, even if during the three-year period, I was asking people to help him, nothing happened. So I decided that things had to change. So for 2 years or 2 years and a half, I worked really hard to try to find the way to create our peer support program locally. So I knew exactly what I wanted to reach, but I didn't know the way to reach it. So it's why it's important for me now, and I'm really, really happy to share that with people who can be interested to create a peer support program. I think that I'm really happy to share that because I know how difficult it was to create it. And in fact, it's really, really easy. We just have to find the good tools to use. So more than 2 years ago, so obviously it's pre-pandemic, and it was not done because of the pandemic. I told you exactly why I decided to create that. So more than two years ago at St. Justine, we officially, after having the support of the authorities, because it's really important when you create a program like that to have the help and the support of the professional resources, the director of the hospital. So everyone has to be comfortable and okay with that. So we create that program, and I'm really happy to say that we are around 20 doctors and one pharmacist who are peer supporters. So what do we want to do in fact with that? It's just to be there for colleagues, because we know that especially doctors, we, even if, as you mentioned, there are very good professional resources, we know how to reach psychologists, and maybe in the different provinces that people will be working in, they have their specific program or provincial program. But anyway, we know that the doctors go for consultation only when it's the end of what they can support, or sometimes, like it happened tragically for in our family, people can commit suicide because they don't go for help enough early in the process. So what is the peer support? Is to be there locally, to be aware of difficult situations that colleagues can live, and to go to them and ask if they just want to talk about it, or to be there when people come to ask you, can you take a few minutes for me, because I need to share something very difficult. So it's what we want to reach.
Dr. Miron, thank you very much for what you're doing right now. And you know, based on a personal tragedy, you turned this into a program that is not only helping people in crisis, but most probably creating in your own institution, and maybe in all of Quebec now, bringing this culture of wellness, of helping each other, and of kindness, I should say, bienveillance, we say in French. Such an honor to have you here today. Kate, thanks you very much for your time and your expertise. And we know you collaborate with Joe Shapiro, and we also have an interview here with Dr. Joe Shapiro. Thank you so much, Dr. Miron.
So thank you for receiving me, and I would like if your association can share my professional email address, because I will be really, really honored to help people to put that in place in their own institution and their own working place. Thank you.
Thank you.